Welcome to the Digital Dose. I'm genuinely excited for this one. My guests today are co-founders of InfiHeal, a healthcare company on a mission to take mental health care accessible, affordable, and stigma-free using AI. Srishti and
Right.
Utkarsh are both co-founders, and with that being said, they come from deep technology background, TCS, Deltec, Fig MD, and hold a master's in computer science from Boston University. Co-founder Srishti built Hilo, an AI therapist that has already reached over 1 million users and generated 400,000 conversation in its first 3 months and has caught the attention of India's prime minister on a national radio address. Most recently, they launched DuoChat, the world's first AI relationship coach, and they've been recognized at the World Economic Forum of Davos and named winner of the AI and All Global Impact Challenge at India's AI Summit 2026. Utkar, well, you came from a pure technology background, TCS, Deltec, FigMD, enterprise software, data systems. Mental health is not an obvious next step for a CS, person. What was the personal moment or realization that made you say, "This is a problem
So
I
I
want to solve"?
personally have been struggling with dyslexia, and I have been in this mental health space for some time now. And I could actually notice that people all over the world, they basically had the stigma of going to a therapist, especially in countries like India. So people were not in the mood to actually go to a therapist. So they wanted some companion who could actually sort of hear them out, who could actually diagnose their thoughts, who could analyze their patterns and their behavior traits. And that's how we sort of came up with a concept called Hilo. So it is basically a bot which analyzes the behavioral traits, the patterns, the any sort of changes in the patterns, and it sort of gives you suggestions based on that. So it is basically acting as a mirror of sorts.
Yes. So I used to be a national quizzer. I went on this quiz competition called India's Child Genius when I was 12 and I froze on national television. And after that, I developed stuttering and social anxiety essentially just got a lot worse. And in this process, I realized that, I basically have diagnosable anxiety symptoms. So we went to a psychologist, and I'm talking about early 2000s. And there used to be a massive stigma in India, where I'm from. And we found that mental health, as Utkarsh said, is fraught with challenges, not just in India. I think we lived in Boston, we lived in DC, and it was really hard to find a therapist quickly. We'd have to wait for like weeks, sometimes a quarter. And I just feel that mental health is super episodic. Like, I need help now. And if I can't get it now, it's a problem. Right. So that's what we want to do with AI. And um, essentially just to make AI to make mental health more accessible, affordable, and stigma free. And then we, of course, found that Chat GPT is being heavily used, right? Harvard Business Review says that therapy and companionship is the number one use case on large language models like Chat GPT and Claude for the year 2025. So that's massive, right? Imagine more people going to Claude and Chat GPT for their mental health than like coding or any other work related stuff. So we thought that this is a huge opportunity, even before it was actually one. And yeah, we feel very validated having seen the progression of AI over time.
Wow. Wow. So India has zero point 0.7 psychologists per 100,000 people. That's one of the lowest ratios in the world. When you look at that number early on, What did it tell you about what needed to be built and what technology alone couldn't solve?
Absolutely. So when we were building this, when we saw that the sheer lack of therapists, that convinced us that humans alone can't bring that kind of scale required to solve this problem, and you had to actually augment human capacity. And when we think of that, obviously you have to leverage technology in some shape or form. AI actually fit in rather well because AI is actually a mega scaler of sorts, right? You can actually bring tremendous scale by just leveraging AI, and it can really augment human capacity to a whole lot. So that was our thesis. That how about we actually don't try to replace therapists, but how about we actually provide a system that people can reach out any time of the day from anywhere in the world, and if it's a severe enough case, like if I have like a psychosis, an episode of psychosis or something very severe, like something clinical, then I should be actually matched to a human therapist. This way, you're able to like triage and figure out like who needs more acute care and who can actually just manage with sort of a lighter mode. Like they can actually manage with an AI companion.
Wow, that's amazing. Well, Utkarsh, you built this with Srishti, IIT Bombay, psychology background, personal lived experience with mental health. You brought the deep CS and data systems expertise. How did that split of skills and perspective shape how InfiHeal was
Well,
built from the ground
to
up?
be very honest, we sort of have leveraged different technologies. We were using like a Microsoft Azure as a cloud storage, and we were hosting the bot on the AWS platform itself. So for that, I really had to brush up my technical skills when it comes to using AWS or when it comes to using Azure. So that actually sort of opened my perspective, and it certainly sort of had an aha moment over there itself, wherein I thought that let's do it and let's leverage AI into this. And as Srishti had actually mentioned, we sort of were trying to implement different guardrails in a bot so that AI can act responsibly as opposed to ChatGPT. So I did a little bit of course on AI as well. So that's how, like, I thought of leveraging different aspects of technology and sort of build a bot which is as per people's expectations.
Wow. Hilo is described as an AI therapist built on one of the largest proprietary real time domain specific data sets curated by the therapists and psychologists. For a healthcare audience that is rightly skeptical of AI in the clinical
Yeah.
setting, what does clinically validated actually mean inside Hilo, and what does it claim to do?
Right. So AI, it's very hard to validate anything that generative AI does because it can give you any kind of response. It can hallucinate. It can do a whole lot of things, right? For us, the main metric was how can you bring down hallucination rates that are maybe 8 to 15% in large language models to something which is sub-zero, right? How do you actually of course hallucinations are going to be there, but how do you really minimize them considerably, right? And the answer lay in actually fine tuning your own model using therapy specific data sets, right? And that's exactly what we did. We worked to fine tune our model and also to build like a multi agent system. So imagine this: if you're coming in with a high risk case, like you're having like homicidal ideation or suicidal ideation, for example, do you think the AI should really talk to you and be allowed to say whatever it whatever comes up, right? We think not. We think that for extremely high risk cases, a human should look at that, and AI can actually be more rule based, and it can provide you with a safety kit and resources, right? Versus a case where you're just having, where you just had a bad day and, you're actually struggling and to cope with, bad traffic, a fight with your manager, and things like that. So that's where you would want more freedom and you would want AI to kind of be very dynamic, right? So we solved it using like a multi-agent system. So every time you talk, we figure out which agent needs to actually talk to you. So if it's a high risk case, it goes to a different agent, which is more rule based and human led. And if it's actually a low risk case, um, and then it's actually more AI led, right? And then there's somewhere in the middle where you have people with clinical diagnosis, but who are actually dealing with life challenges. Here, AI can actually help with psychoeducation. But what AI shouldn't do or shouldn't venture into is diagnosis or prescription in and of itself without human intervention. We don't believe it should be doing that, right? And if people suppose come on our platform and ask for prescription, that's where there's a human in loop again, similar to the high risk case. We again match you to a psychiatrist because they're the only ones who can actually prescribe medication. So that's how it is.
Makes sense. Makes sense. Well, Hilo hit 1 million users and 91% report improvements. Those are remarkable numbers. What does that engagement data actually tell you about where people are struggling and what surprised you most about what users were bringing to the platform?
Okay, I'll take it. So actually, we were focused on Indian market. We built it for
But
the Indian
soon
market to
enough,
solve
because
our
I
problems, and but soon enough, because
we
ours was a multilingual platform, we actually found organically like a lot of people across the world start to use it, right? European Union, we saw users from Latin America and from places that we had no idea needed the solution, right? And this kind of organic demand told us that we're doing something right. Like the market is actually telling us that there is a need for something like this. Like people are looking for a safer alternative to chat GPT therapy and Gemini therapy, essentially. And we were at the right place at the right time. We were building the right tool much in advance. So we were able to take advantage of the whole the peak that we saw. And I still think the peak is yet to come. I do think that what we have now is a little bit of apprehensiveness around AI in healthcare in particular, because we also feel that it might, take away jobs or it might create safety issues and things like that. And those are valid concerns, which is why I think what we have should be regulated well. And when you build a product like that, you have to look at regulations across, right? And really see, be compliant with HIPAA for United States, GDPR for EU, and so on and so forth, right? So yeah, that's what got us really riled up, and we just were like, we went all in. We were like, let's look at how to make it safe and also approved by regulatory bodies across. Um, we have been able to somehow manage because our positioning is more of a wellness product and not a core clinical one as of now. But we actually also
okay.
hope eventually to integrate with healthcare systems across the world. Yeah.
Phenomenal. Well, DuoChat is described as the world's first AI relationship coach. Two people in a private shared space with AI and a facilitator, not a replacement. That's fundamentally different design, philosophically, than most AI tools. When did that idea clarify, and how do you make sure the AI is facilitating rather than deciding?
Like essentially, DuoChat came to us when we were on essentially a work trip. We were in northeastern part of India, and somebody from IIT Guwahati, like an intern, there actually suggested that we actually AI is actually making us solitary. So how about we use AI to bring people closer, right? And that was just an idea that clicked. What if AI could actually indeed bring people closer? Because one of the main issues that people come onto our platform for are relationship problems, right? And often people would actually send screenshots of their chats with their loved ones and really ask us what the other person meant. Why did they say that? And do you think that this person cares about me and stuff like that? What if the dialogue was more equal between the two people? What if it was more symmetric? What if the other person was actually a part of this entire conversation, right? That's how the idea really materialized. So we were able to actually provide a platform, create a private chat room for both people, even as Hilo took on the role of being a mediator and a silent one. So it doesn't intervene if things are going right. It lets people talk it out. But if things go south, if people are abusing each other, if they are name calling, if they are being defensive and they're going around in circles and not being able to resolve their problem, that's where AI actually interjects. Similar to how a mediator or maybe a relationship guide
And
might, or a
also to
relationship coach
basically
might.
add to her point, a lot many people they actually wanted a counselor or a facilitator to actually like guide them like 24/7 because like many sort of relationship counselors are not available 24/7 and only few of them are like available in here in India. So that was a big idea for me, and that's what I suggested to her also, and that's how like we sort of implemented it together.
You presented at Davos and have been a part of the India AI Summit. There's a global conversation happening right now about about responsible AI in healthcare. Where do you draw the line on what InfiHeal AI should and shouldn't do? And how do you build those guardrails into the product itself?
Yeah, I mean, there's a lot of conversation even during Davos about ethics of AI and AI safety and how do you really build an AI that's responsible enough. And to be very honest, the conversation has just got started. And we have been, internally discussing this for the longest time, ever since we started building this. And there are, of course, certain takes. We personally believe that AI is great as something that augments human capacity, something that finds patterns, and something that can do the repetitive part of what a therapist has to do, which is to take down case history and that kind of stuff like booking of appointments, reminders, etc. So that's actually the area where technology should really be used, and for support before therapy sessions like as the gateway to mental health ecosystem, and also for support in between therapy sessions. You could also conceptualize AI as like a AI journaling kind of a tool where you basically write down your thoughts, it probes you further, and you basically understand how your thoughts connect and what the issue is, right? So it's useful as that. Should it be prescribing medication? Should it be diagnosing you? Should it be dealing with high risk cases like homicidal ideation, suicidal ideation? Um, should it autonomously, give you a therapeutic course of action? Should it guide you through modalities that are risky? It shouldn't, right? And that's how we would like to draw the line. So whatever people can do on their own in the safety of on their own by themselves safely is what we think AI can recommend. Like um, just good things, universally good things like lifestyle recommendations, the 5-4-3-2-1 exercise, mindfulness, right? Those are universally things that seem to help people. And of course, they shouldn't be contraindicated for that condition, because I know even with meditation, some forms of meditation don't work for people who have, trauma. High intensity exercise doesn't work for everybody, right? So there needs to be nuance there too. But broadly speaking, that was our idea, and adding guardrails, ensuring that there are different agents handling each type of risk profile, having humans in the loop, ensuring that there is enough safety and security of data. We are compliant with HIPAA and all the other regulations around the world. So that was our goal. Of course, a lot more can be done. Like there's a lot that can potentially happen, but yeah, this was essentially a starting point for us.
Wow. Well, you've been recognized Davos India AI uh, su- uh, India AI Summit,
Yeah.
Bengaluru Tech Summit. But mental health crisis isn't just in India. The U.S. healthcare system has its own therapy shortage, its own access and affordability problem. How are you thinking about taking InfiHeal beyond the Indian market?
So we are already in 165 countries. After India, US is the biggest market for B2C. We are actually planning to launch a B2B version of our product as well by partnering with healthcare institutions. But that would, of course, require, as I said, that would require a more clinical positioning because to integrate with insurance, you have to, it has to be a medical device, software as a medical device, essentially, right? So there's a whole lot of regulations around that as well. Right now, we position it more as a companion which is for emotional well-being, right? So we'll have to go a little bit hard on our positioning, and yeah, I think right time for that would be soon. Maybe something by the end of this year. But yeah, we are closely also working in other markets aside from United States. We are actually closely also working, um, in EU and also in Latin America.
Wow. Well, you've described InfiHeal as Google, but better for mental health. That's a big statement. 5 years from now, what does mental health infrastructure look like if InfiHeal executes on the vision, and what gets solved that isn't solved today?
I think five
Yeah.
years from now, we will be interacting with voice agents and we'll be telling our voice agent, hi, like I have so much on my plate. Or like, can you pull up this, really relaxing song so that I can calm down for a bit? So I think the future will lie in like maybe even interfaces which connect your brain. I don't know, maybe that's where we are headed, right? Um, yeah, so I think as a whole, I think that's where we're going to go. And across every hospital, I believe most hospitals, most healthcare institutions will have their own version of, an AI chatbot, right? Which will be more front facing. Just like on e-commerce site, you have like chatbots that help you resolve customer support queries. I think that a similar thing would be there in all the healthcare apps. It will not be customer support, but they will be to guide patients and to take care of the first step, like the hospital, you know, how essentially how to sort of become a part of, like just it'll act as the first layer, essentially, in a healthcare ecosystem. So that's where we see the mental health infrastructure head.
Well, if there's someone listening right now, a healthcare IT leader, a founder, a clinician who's either struggling quietly with their own mental health or watching their team struggle and not knowing how to help, what do you want that person to hear from you today?
Am I audible? With whatever problems basically you're struggling with. And this is the app which we have developed is a sort of a mental health companion. So, which will sort of like analyze your thought patterns, your behavior, and whatever problems you're facing through, it will sort of guide you on how to like solve them.
Utkarsh, this has been a really important conversation. What InfiHeal is building, matters, not just for India, but for anyone who has ever needed help and couldn't get it. For everyone listening, check out Hilo and InfiHeal at infiheal.com. Thank you for being on the Digital Dose.